So many times negative emotion is coming from some place of helplessness or shame inside of us, right? The shame coming from trauma. And then we want to hold someone responsible. And sometimes it is aggression outward, but sometimes the person we're angry at and hold responsible is ourselves. And there's the negative self-talk, right? And there's the way that we beat up on ourselves, and we inadvertently then just perpetuate our own trauma. And like, we don't have to do that, and we can change that, and we can change that like, right now.
Hello, everyone. I'm Dr. David Perlmutter, and welcome again to The Empowering Neurologist. You know, we all have trauma in our lives, and it's important to recognize that trauma affects the platform that we use to see the world moving forward. Traumatic events color how we see new events that happen thereafter. And unfortunately, early life trauma, or really trauma occurring at any point in our lifetimes, doesn't seem to be addressed as it should be, especially when we consider the fact that traumatic experiences can have bona fide physical manifestations. They can affect our longevity. They can affect our biological aging, our immune function. And really, my point is that they really need to be addressed. We really need to pay attention to trauma and do our very best to unravel trauma in terms of contextualizing it, how it's influencing each and every one of us day by day. And this is the focus of a new book that we're going to be looking at today called Trauma, The Invisible Epidemic by Dr. Paul Conti. Let me tell you a little bit more about Dr. Conti. Dr. Paul Conti, MD, is a graduate of Stanford University School of Medicine, and he then completed his psychiatry training both at Stanford as well as at Harvard. He then served on the medical faculty at Harvard before moving to Portland, Oregon, and founding a clinic. He serves patients and clients throughout the United States and internationally, including the executive leadership of very large corporations. And again, the new book that we're going to be talking about today is Trauma, the Invisible Epidemic, How Trauma Works and How We Can Heal from It, with a very interesting introduction by Lady Gaga. So I think you're going to really enjoy and find quite helpful our time together today. Let's get right to our interview. Dr. Paul Conti, welcome to the program.
Thank you very much. I appreciate you having me on.
And I was telling before we went on that how much I enjoyed your book, and God, how lucky I am that, you know, cool guys like you writing such amazing books, that I get the opportunity to read them. So thank you for that. And I'd like to jump right in. I talked about it in the introduction, about the importance of trauma, how trauma is so unrecognized. Mm-hmm. And even if it is recognized, how people don't want to talk about it. But what was the interest for you? How did you get into this whole area, and why did you think it was so important?
Yeah. You know, I just started seeing over and over in the work that I was doing that trauma was really foundational, you know, that it was undergirding all of the things, or almost all of the things, that I was trying to treat. And you know, there's not a lot of commonality amongst all the different things one might be treating as a psychiatrist, right? But to see that undergirding depression, undergirding anxiety, panic attacks, obsessive compulsive disorder, right? And a lot of just the general angst, right, that runs through our lives that people come to care for, was trauma. That if you trace those roots back, right, if you talk to people in a therapeutic process, or even in a just data gathering process, right, that what you would learn is the roots of those problems reside in trauma, and they grow different branches, and they, you know, so they looks different in different people. But ultimately, if we're really going to go to the root of the problem and try and enact something that's really makes a huge difference and can be curative, that we just have to look at trauma and seeing it over and over again, and then seeing how little it was being recognized, right, as the root cause of depression or addiction, for example, really, you know, led me to just focus on, like, there's something here that needs to be written about, talked about. Like, there's something so germane to the helping profession that I'm trying to do as best I can, that I've got to think about that, write about that, like get the message of it out there.
Well, I mean, the whole idea of what's undergirding, to use your word, is certainly familiar to all of our viewers of this podcast. That, you know, as I've said so many times, it's so important to focus not just on the smoke, but on the fire. And as it relates to psychiatric issues that we as professionals deal with, so much is really just dealing with symptomatology. So much is just
Yes.
targeting, these therapeutic options of perhaps increasing the availability of serotonin or giving
Right.
people medicines to calm them down. And how refreshing it is that you put out a book now that's saying, that's all well and good, but what's going on in the background? Why did we get to this place? And you make it very clear early on in the book that that is really under-recognized, and the value
Yes.
of it is under-recognized.
Yes.
Well, why is mainstream medicine, certainly mainstream psychiatry, so reluctant to really want to explore how fundamental trauma is in all the manifestations that you just described?
Well, I think we live in a world of quick fixes, right? We live in a world of, well, soothe symptoms and then we'll call it good, right? And certainly medical care is that way. I mean, we have a medical system that's very good at doing acute, complex things, right? But we're not good at prevention, right? We're not looking at the bigger picture that requires time-intensive, human-intensive work over time. Right. And instead, again, I use this analogy a lot that we want to sort of polish the hood when there's a problem in the engine and then kind of call it good. Right. Because things
I'm
look a
going
little
to take
better.
that from you. I'm going to steal that. But go ahead. You'll hear that from
Yeah.
me in the future. That's for sure.
Great. Great. I mean, that's what I would feel though so often. Like I would feel like, oh, this person has been through like a lot of treatment. Right. And like all it's done is polish the hood. Over and over again. And nothing got to the roots, right? And like this person's problems continue and their life dysfunction continues, sometimes even threatening their life, right? But certainly decreasing health and happiness for the person and the people around them. And, the systems want to look at, well, what's the next thing we can do? We increase the medicine. We make there be more serotonin available here or there. And as you said, it's all well and good, but it's all well and good if it's seated in an attempt to actually understand what's going on. Otherwise, I think it actually does harm, right? Because, people know when you're just polishing the hood, you make a little more serotonin available with this medicine, or you do something with that medicine, or give a sleep medicine. And now they sleep better for a little bit before the system overcomes that too. And I think that can be a real sense of hopelessness and a sense of despair. And where does that go? Through the lens of trauma, then the person blames themselves for not getting better, right? So I think we have a healthcare system and a mental health care system that by and large is failing us. Right. So it's failing individual people who then internalize that the failure is their fault. And I think the systems often promote that, right? If you're not getting better with what we've decided for you, then you failed this or you failed that, right? I mean, we actually use those words, right?
And words that you used in the book, I think many times was really related to the fact that shame is sort of the running partner of trauma, that because you failed, you're feeling shameful. Right. And how valuable that is to when we finally contextualize where this shame is coming from and can call it out for what it is and identify its etiology, then we're in as you called it, a more of a movable place where things can now start to shift. I think in the foreword by Lady Gaga, there's the description that you told her it would take 6 months, or it did take 6 months, till you finally characterized her underlying manifestations of trauma to be, as the word was, movable.
Yes. Yes, that's right. And again, that is the opposite of the message that American medicine and medical care often wants to give, right? Which is, look, we're talking about your problems. Just shift your thoughts a little bit. Think about this and not that, right? And go do this and not that, and take a couple of these medicines, and like we're gonna call it good, right? Right? Yeah. Be a good patient.
And if you go after 15 minutes,
right. Right. And if not, then you should feel ashamed of failing the treatment for your shame. Right. And like, what harm are we doing with that? When I think there's just common sense here that says we need to look at the root of problems. Right. And again, that root very, very often goes back to trauma, and it is very addressable. Right. And that's, the intent of the book is to be very, very practical. Right. It's not meant to be esoteric and, we can understand some things, but like, we don't know how to apply that knowledge. Right. It's the opposite. Right. It's saying that the truth here is consistent with simplicity, and it's straightforward of like, how about we look at what is actually ailing someone. Right. And then we try and enlist in a collaborative way right? The person, right, to come along with whoever's trying to treat and help them to actually solve the problem. Right. So as you mentioned in the foreword of the book, like being able to explain that to Stephanie, that it wasn't going to be like, it's nothing we just talk about now. Like we have the answer to it. Like we have to think about it. Right. And we have to be a back and forth. It's an understanding process in you and in me. And sure, we can treat symptoms along the way, but what we're really looking for is understanding, and like it requires time and effort, and it has to evolve over time. And when you say that to someone in a way that says, look, I can do that with you. Right. And like we can do it. It gives them hope, right? It's not despairing to learn that, it's going to take some months to get our arms around this. I mean, that's a good message when the alternative is what? That person's desperation and despair that like nothing is getting better, right? And that's a desperation and despair that I've felt myself in my own life. And when we feel that as humans, we want an explanation, we want an understanding, and we want a pathway. And if we're given something that just sounds like, just polish the hood and you'll be fine, like it doesn't go well, right? And we kind of know that.
Well, you've said a lot just now and I want to recap just a little bit, because I think you're making it very clear that it isn't necessarily easy to do the work. That the easy way out is to take the Lexapro and be done with it and hope for the best. But again, as mentioned, you're treating symptoms and really you're doing everything you can to avoid confronting what may well be the underlying issue or issues here. And that it isn't, right, as you said, as is said in the foreword, 6 months to even get to a place of being movable, that it's going to take some work. But right, from your description, ultimately it's absolutely worth it, because now you are clearly putting the fire out. You've identified the problem, right, and can contextualize it. And I think, the value of your book is it's giving people two things. It's giving them hope, and it's giving them tools.
Yes.
And this isn't
yes,
what you get in the 15-minute interaction in a doctor's office where you end up walking out with a prescription.
Right. Absolutely. It's a mechanism of deceit, right? That we can do this with ourselves as human beings. I mean, how many people who say want to lose weight, buy the diet book and hope for the best, right? And that's like take the Lexapro and hope for the best. But it's a false hope, right? And we often know that, like on the patient side of things, like we will sense the falseness of it, right? And that even in buying into it, we're buying into something that's false. Right. And good things don't come for nothing, right? Like getting the diet book doesn't make a person lose weight, right? It's the attention to like, what is the diet? What is the person actually eating, right? How are they exercising? Like it's the bigger things that take effort, right? That actually make our lives better. And we've developed this short-sighted view, which I think is not just an American view, but we want what we want when we want it. And that need for immediate gratification or wish for immediate gratification without the investment of time and effort, means that we end up all deceiving ourselves, right? And look, what's so bad about the message that it requires time and effort and work, but things can be so much better. Like, I think that's a wonderful message, and it's a wonderful economic message. I mean, if you think about so much of this is done through the lens of cost containment, right? Well, you might say, okay, you look at just the cost. There's just 15-minute appointments and Lexapro's inexpensive, right? It seems like that's a lower cost, but we're not taking into account what about the human cost, right? Of suicides that could have been prevented, right? Depression that takes away from enjoyment and productivity, right? And what about the emergency room visits, right? The other medical health problems, right? That get so much worse in the context of mental health problems, right? If we actually look at the big picture, even if we just think about dollars and cents, and we factor out, let's say we're not thinking about the human beings, which of course isn't right to do, but if we just look at it from that perspective, taking the longer term view of it is better. But we're so lost in the short term that even our methods of accounting what makes sense and what doesn't make sense is like we're just looking to the end of, we're not seeing beyond the end of our noses.
It's very interesting because you and I have come to a very similar place on different paths, different roads that lead to Rome. In my world of neurodegenerative conditions, again, it's live your life come what may. Don't address your blood sugar. Don't address your inactivity, your sleep disorder. And when you become cognitively impaired, we will have a drug for that, whether it's Aricept or some new monoclonal antibody that's going to get rid of beta amyloid. And what we know is that they don't work. And yet, if we address the underlying issues, the inflammation, the insulin resistance, the glucose dysregulation, et cetera,
Yes.
we
Yes.
can really, address the mechanisms that are involved in the brain
Yes.
degeneration. And I think it's clear that you're saying the exact same thing, that, this trauma experiences they manifest, ultimately, they come to the surface as the things that then have these ICD code for which you can prescribe a specific medicine and be done with treatment. You draw some similarities between trauma and two things: viruses, the way viruses spread through society, and also sort of the unrecognized dangers of air pollution. Let's start with the viral analogy. How does that work?
Yeah. Well, the trauma is in so many of us, and if we don't know it and we don't recognize it, then we pass that trauma on, right? So even from the perspective of, if I'm suffering from trauma and I'm not doing a good job taking care of myself, say, and I'm depressed, right? Then I won't be as good. I'll pass some of that along, say, to my children, right? Because I won't be as good a parent. Right. And so it can come in those sort of indirect ways, or there's sort of the repetition compulsion. Sometimes gets called that in trauma, where in trying to solve the trauma, where we present ourselves or put ourselves in the same difficult or dangerous situations where the trauma arose. And we can repeat patterns like, choosing unhealthy jobs or choosing unhealthy romantic partners, for example, that we tend to sort of pass this along in a way that makes our own trauma worse and often has then an effect on the people around us, including sometimes trauma makes people externalize, right? So there's anger and aggression. And I think a lot of what we see, I think, in our modern political landscape is really just the discharge of anger and aggression, right? I mean, it's not really about, like two people are having a dialogue and trying to come to some understanding, right? Or even some arrival at what's fact versus what's opinion, right? So much of the dialogue is just like, I'm mad, I'm angry, and I want others to feel my aggression. Right. And I don't care if 1 + 1 is 2. If you say it's 3, I'm going to argue with you about it. Right. Because there's so much anger and frustration that we see over the socioeconomic situation in the country and the erosion of faith in the socioeconomic foundation as a way that people can work hard and get themselves ahead. Right. And support a family. I mean, entire industries people can't do that in anymore. Right. And then you think about systemic racism, you think about the political discourse and people feeling helpless and just wanting to assert themselves. And there's a real danger of that, is that we pass along the trauma because we're angry and we're upset and we don't know why. And we run the risk of the destruction of our society. So I don't think that's an overstatement. I think that if we're not looking at what's going on in ourselves and what's driving our choices and behaviors and opinions, right, then often we're just projecting out our frustration. So in direct and indirect ways, we're passing trauma along back and forth, and we don't see it like a virus. We don't see it going from one of us to another and back.
Well, you did talk quite a bit in the book, not quite a bit, but mentioned several times how trauma influences people to be bullies, and
Yes.
how that's their their manifestation then of dealing with or the effects of that trauma in that individual. And when we think of bullies, we think of kids out in the playing field,
Yes.
in 5th grade. But reality is we're seeing that certainly in the media, in adults playing out today. There's an awful lot of bullying going on. It's nothing that is just confined to children. And again, to use your description in the book, this is a manifestation of what did or didn't happen earlier in life. And, it's a call. It's a call for, trying to unravel those events earlier in life.
Yeah, and I think earlier in life and also right now, right? Because you need to go, why? Like, right, when I hear the word bully, there was a time I would think of like a kid on the middle school playground, right? Now I don't. I think of adults like you and me, right? Who want to have their way. But I then think of the very frightening fact that it's not even linked to an outcome, right? It's just I want to have my way, right? I want to assert myself. I want to feel powerful, right? Because I feel weak. I feel unappreciated. I don't see prospects of making life better. And then people just want to assert themselves, right? So the bullying isn't about the outcome. right? It's about the act of the bullying as a reaction against impotence, right? Against feeling weak and feeling incapable
And not
and like,
validated,
right,
not
and not
recognized.
validated. Right. And what are the roots of that? Right. The roots of that are trauma, are in trauma. Just like I think you were talking about the neurodegenerative conditions, right? That you're fighting against, right? And looking at like how are people taking care of themselves? What are they investing in themselves? And a lot of that difficulty in people taking care of themselves also comes through trauma, a sense of hopelessness, a sense that I can't really control my fate anyway. And then isn't it easy to believe in the lie that, oh, if I get Alzheimer's disease later on, and part of that is I didn't take care of myself and I could have, that there'll be a pill for it. I mean, it's easy to buy into that lie if we feel like we can't do anything to change it now,
If we don't
right?
have
But
agency.
having a sense of agency and empowerment to guide our lives forward changes all those equations. And in many ways, I think the things that you're advocating for on the neurological front and I'm advocating for on the psychiatric front, they're hugely intertwined, right? And they're about a sense of agency and a sense of empowerment, as opposed to a sense of hopelessness, which then leads to wishful thinking. That Lexapro is going to solve the problems of I'm suffering from violence in the home, right? But the Lexapro will make it better, right? Or, I'm not taking care of myself. My glucose is high. I won't have any problems later on. Like, it's a fiction, but it's easy to buy into that fiction if a person feels helpless. And our helping systems often leave people feeling more helpless than when they came in to the helping systems.
Well, the glasses are going on, and that can only mean one thing, that it's time to read it. An interesting quote out of the book from Stephanie Zu Gutenberg, who is, kind of a world-recognized advocate for children.
Yes.
And, about a third of the way through the book, you divert to interview her, ask her some questions. Yes. And one of the responses, I think, is really very meaningful because it kind of summarizes so much about what the book is about. And I'm going to actually read it.
Yes.
And yet, there's still this common idea that trauma is something discrete or limited to the time when the event happened. It's almost as if we can only see it through a legal lens, like something bad happened at some point in the past where the trauma is sort of contained, but especially when it comes to children, trauma isn't like that at all. It affects everything else in life going forward.
Yes.
What we don't get is that people are fundamentally changed by trauma. They're changed biologically. We're going to talk about that. They're changed in terms of gene expression and hormones and chemicals and neurotransmission. And that goes on forever. My hope is that people's notions of trauma catch up with the scientific research. So there's a lot that that we can unpack there, but the notion that trauma then has manifestations in terms of our immune system, in terms of inflammation, in terms of autoimmunity, in terms of gene expression. That trauma, we've seen this in laboratory rodents, that trauma affects gene expression in that generation, but that gene expression can be passed on to the progeny of the traumatized parent. That's
amazing, right?
It is amazing, but that said, one of the things that we know trauma does, we've known that people with post-traumatic PTSD, and then you sort of you kind of clarified that term for us in a certain context in the book. We'll talk about that. But that people who have been diagnosed with that have a dramatic increased risk for senile dementia of the Alzheimer's type, possibly because of a couple of things, that their baseline cortisol levels are elevated, damaging the hippocampus, number one. But number two, their levels of inflammation are higher. And interestingly, what we just wrote about in our last book was the role of inflammation in disconnecting people from the top-down control of the prefrontal cortex, the adult in the room, the non-bullying part of the brain, the role that it plays in reining in the bullying part, the non-empathetic, the self-centered, the non-future looking part of the brain. And what we see with inflammation is that that's how people then become. They become those, they manifest their trauma quite without any restraint whatsoever. And, your commentary both now and in the book about what's going on in society, I think when we think about those mechanisms, it all becomes pretty clear. The question then becomes, what do we do? What's our fallback now? What can we do?
Well, look, I think we can use our understanding to actually address it. I mean, if you think about what we're saying here, and it's not just that like we're saying it. I mean, we're saying it because the data is there, right? That tells us there's an immense problem here, right? That trauma doesn't go away on its own, right? It's not like a bruise. Well, give it time and it will heal. Like it doesn't, it stays inside of us and it drives dysfunction as if that trauma is still with us in every moment. Right. And then our brains and our bodies are in survival mode. Right. And survival mode, for example, it is a high inflammation state. Right. It is a state that's looking for threat. Right. It's a state that is about like, let's shift everything towards surviving. Right. Which again makes sense if we're under direct survival threat. Right. But if we carry that forward when we're not under direct survival threat, now we have high levels of inflammation, right, that are carrying on over years and years and years and promoting cardiovascular disease. So promoting dementia, promoting heart attacks, promoting strokes, right? And that goes on over years and years. And it changes our mental state in a way that we forget that there was a way that we functioned and existed before that, right? So then we perpetuate that because our perspective is changed, right? We see new people not as like, oh, you're interesting to me. Let me learn something about you. But we just see, are you a threat to me? Right? Which can raise our own defensiveness and our own aggression. It changes the entire lens through which we see ourselves and the world. And you can see how if we let that build upon itself and get projected out into the world and bounce from one of us to another, right? How we can really lose our grounding to even to a civil society that's functioning and that has mechanisms of helping us at all, right? You can see how we can lose that. Oh, and we know as you said, we can pass it along to generations to come, right? Like to me, I don't know what's a greater call for urgency, right? And the fact that it has like solutions, right? Of like, let's go and look at that. What are the roots of the trauma? Can we help people reorient to who they actually are, which would be who they were before trauma, right? Like, why can't that be who we still are, right? And it can be unless the trauma has run away with us and we don't realize that there's any different. And I don't know what better purpose can there be for mental health helping mechanisms than helping people realize that. Then what dysfunction will we decrease in the world, right? Outside of us and also inside of ourselves. So it is amazing, but it's also simple. Right. There's also a simple common sense aspect. And I think when something is amazing in the breadth and depth of its impact, but also like simple and common sense in its route of approach, then that's where I feel the urgency to say like, well, we need to shift how we're looking at this and what we're doing. Right. Because all the data tells us that's exactly what we should be doing. And that the way that we're doing it isn't helping us. And in fact, it's not only not helping us, but on balance, it's likely hurting us.
It's a fundamental conversation, isn't it? I mean, here you are mentioning that we really need to embrace the transgenerational implications of what's going on with respect to trauma. And we know when you look at the lack of attention to climate change, for example, which is a future generational consideration. Right. You don't have to go any further than to recognize then that it seems that there is a lack of empathy with respect to not only each of us today, but certainly future generations. The other thing you mentioned was this notion of trauma related to survival, and that there was a discussion in the book about your uncle Rango.
Yes,
and boy, that was a tough situation that he lived lifelong with a very, very heavy trauma hanging over him, but the event was a survival event. Why don't we talk about that and then talk about how that played out and maybe what could have been done for him?
Yeah. I mean, the reason that he was able to live a good life with that trauma is because he understood it, right? And he understood that it wasn't him who put himself in that situation, right? He was in a situation no one should have to be in, right? And he made the decisions that he made in the service of a higher good, right? His moral and ethical grounding to taking care of the people who were under his command, right? They were his charge, and he needed to take care of them and shepherd them forward. And that responsibility, which was clear and good to him, and he had accepted it and sworn an oath upon it, and he was going to carry it out. And if it meant doing something terrible, right, then he could shoulder that burden because he saw the meaning in it. And that's like, that makes all the difference, right? And to see, even if we're suffering from trauma and we don't say the meaning in it, right, in a way that he saw the meaning of what he had done for a higher good, that we at least we see that we are not responsible, right? That we don't deserve shame for being traumatized, right? And that what is our responsibility is to make our lives as good as they can be, right? It takes a sense of agency back to us. And I think my Uncle Rango retained a sense of agency and a sense of empowerment through his trauma. And it's that sense of agency and empowerment that we need to give to the thousands upon thousands upon thousands of people who are traumatized and have lost that sense of empowerment, lost that sense of agency, hence the pervasive anxiety, right? Hiding oneself from the world, and depression and sleep disturbance, right? It's that meaning that has to be restored. And we have the helping mechanisms to do it. We just often don't do it because in very limited therapy sessions, long periods of time to access, and throwing one medicine after the next at people, there's like the helping system doesn't even try and do it. And then we don't get back agency and empowerment and a sense of meaning.
So I'll leave it to the reader to to fully explore what your uncle went through. But it seems that incredibly awful experience and decision that he had to make, ultimately he recognized that for the greater good, that's what he needed to do, and worked with it. And I think it was actually a very empowering example for those of us who would maybe not have been able to do what he did, or if we did, how that might affect them moving forward. I mean, we all know of people who've had to do certain things and yet couldn't work their way through it. You talk about that there are direct effects of trauma on the limbic system. And I wonder if you couldn't just open up a little bit about the limbic system, why it's important, and then what are some of those lasting changes that are imparted on this limbic system from traumatic events?
Sure. The limbic system, which we could also describe as like the emotion system in us, right, is really the system that generates meaning inside of us. It's not facts that have meaning. It's the emotion that we relate to them, right? Like I can think of the fact of my daughter and her name, but what makes significance is that I map the emotion, right? I map the love and the care that I feel, right? And then that makes the meaning inside of me. And the limbic system will shift towards a beleaguered place, which can be a place of defensiveness, of fear, of anxiety, of aggression. It can be all those negative things that they start coming to the forefront when we are traumatized, right? Hence, like really good studies that have looked at people who've been through trauma, and if they see like a new face, a new person coming towards them, they have a very different response than interest and curiosity, right? They have a response that's coming through the limbic system's bias towards threat, right? Towards feeling beleaguered, right? So just worried, are you a threat to me or not, right? Because the limbic system now is so interested in preventing further trauma, but it doesn't actually know how to do that, right? It's just amped up and it's looking for threat all over the place, which is why we end up in higher inflammation states inside of us, right? It's like a state of red alert when there's no red alert. And look, when we're in a state of red alert, we miss other information, right? I mean, if the fire alarm goes off in one of the places you and I are at, like we'll pay attention to that, right? We won't pay attention to the last thing one of us said, or right? Like we'll miss information because there's something urgent going on, right? But if the limbic system is telling us there's something urgent going on all the time, we miss a lot of information. And then how does that change our decisions? Now we feel threatened all the time, and it's going to change our mood, our anxiety, our sleep, our behaviors, right? So, and it also changes the emotion that gets linked to our memories. Right. And I think that's among the most frightening aspects of trauma is like seeing people or working with people and just knowing people in my life, like before and after trauma, and how our memories are changed, where the person will link emotion that is negative to a memory that had good emotion. Right. It's the example of a high school award that made the person feel good about themselves and like they were capable and could navigate the world. A person's reflection on that after, say, being traumatized, maybe in a relationship or occupationally having disappointments, maybe disappointments based on prejudices or whatever the case may be, then the person looks back on the memory, say, of that high school award and sees something to be ashamed of. Well, people gave me things for nothing. And, it just showed I was going to have this hanging over my head and never make anything of myself. Like that's not what the person felt then. They felt hope and they felt confidence. They felt a sense of agency. But trauma changes that because the emotion now is all coming through this lens of feeling threatened and beleaguered. And it changes our memories then, because it changes the emotion that make our memories real and alive inside of us.
So trauma makes us feel threatened, and actually being threatened is traumatic. And I say that because I think in our modern world, when I say modern, I mean in the past year and a half or so with COVID, I think people are feeling threatened. I think everything that the paradigm has changed. The playing field is so different, and that's very disruptive and threatening to people. So it really represents a bit of a global trauma. And I'm interested to know what your thoughts are on how, with understanding how what the manifestations of trauma may be. What's going to be, through the lens of trauma, the manifestation of what appears to be this ongoing event?
Yeah, I think unless we do something to course correct it, I think the answers to that are going to be all very negative, right? That the people being behind closed doors has increased all sorts of problems in us, right? The isolation, right, increases the ruminative negative thoughts in people, right? It promotes depression, right? The isolation from others, or if there are difficulties behind closed doors, right? Whether it's emotional abuse, physical abuse, substance abuse, right? Like these are things that tend to play out more behind closed doors. And there's a weight of all of these things on us as a society. Right. And then being more behind closed doors, people then reach out through the computer, right? Through the mechanisms we have of communicating and connecting. And like anything else that's so broad in its applicability, that could be used for good or for bad, right? And a lot of the social media mechanisms and the media mechanisms in general appeal to the lowest common denominator, right? They appeal to just connect with others who are angry the way that you are, right? There's a detachment then that often the ways that people are seeking communication and connection get narrowed down to coming through the lens of trauma, right? Through those, I'm angry and I'm frustrated, and I'm going to connect with people who are angry and frustrated like me. Oh, and then we're all mad at that. We're all mad at those people, right? And then we end up compartmentalizing, right? And the problems inside of us get more and more sealed inside of us, and then they spin and they get worse. And whatever it is it's fueling in us, depression, anxiety, aggression, gets worse. And we're going to have to step away from there's a theme here to what we're talking about, right? Which is like the quick fix isn't the answer. Right? The diet book isn't the answer, right? The Lexapro often is not the answer, right? And the answer to this is in building social bridges again, building communication again, building dynamics and role modeling that guess what? You and I can disagree about something and not immediately go to each of us has to think the other's a terrible person. Right? Maybe we disagree and have a dialogue, and you know what? Gosh, you told me things I didn't know, and I have to rethink my opinion. I'm like, why don't we do that anymore? Right? We don't see that modeled in front of us, right? And we're in trouble if we don't do this ourselves and role model this for the generations that are coming up behind us.
I'm smiling because I did a podcast several years ago with a Dr. John Douillard, who was all in thinking that gluten is a good thing in our diets. I happen to disagree with him. We were on for over an hour and a half, and we were talking about the science about gluten and what it does in the body. And he was countering my science with other science. and it was respectful, and we
Right.
ended on a wonderful up note.
Right.
And the comments, and we had hundreds and hundreds of comments on it, had nothing to do with gluten, good or bad. That was amazing. You guys
Right.
actually had a respectful conversation. I mean,
Right.
you don't see that. You just do not see that in our world. We are so hyper polarized.
Right.
I wanted to tell you that as I was reading your book, I dared to confront a very traumatic event in my life, and I realized immediately how close to the surface it really was and is. As you can see right now, as
Yes,
I think my
tell.
demeanor has changed,
Yes.
I can't hide that. But
Yes.
I guess that would be an indication that it really hasn't been framed, it hasn't been contextual, hasn't been dealt with appropriately, because I think it still nuances my emotions and responses to things that may be connected to it, much as I think there was a city that had a name similar to pancreas or pancreas that you talked about, and it conjured, it related to an experience one of your relatives, I think your aunt or somebody, that had pancreatic, or I'm not
My
sure, was it
mother,
your
yeah,
mother?
my mother had died of pancreatic cancer,
Pancreatic
and the
cancer, and
similarity
you
of the
visited a
words.
city that
Yeah.
was pancreas or something, and
Yes.
how that kindled that emotionality. But I hadn't confronted or dealt with that event until I decided to, reading your book. I
Wow.
know full well that it has affected me, and I think for me moving forward, I have to deal with that. I think I have to work with that a little bit.
Yes.
So, and I think you've got great tools in your book. I mean, you
Thank
end the
you.
book talking about knowledge, power, healing, hope, and urgency. And I think the knowledge part, correct me if I'm wrong, is really understanding how pervasive, indelible to some degree, but how influential then, let's say, trauma and traumatic events are in our physical and emotional lives.
Yes.
I feel it right now. But
Yes.
beyond that, perhaps the power that these events have in affecting us, and the power, I think, another way of looking at the power that we have to unravel them and understand them. And that's where the healing takes place, that we
Yes.
should have hope, which I'm very grateful for in your book, certainly not just for me, but the urgency. Tell us about the urgency.
Yeah, there's a linkage there that I think is a very simple, common sense linkage, right? So the idea is the book itself, and then of course there are many, many, many ways to learn about trauma besides the book that I wrote. But the book is meant to impart some knowledge and encourage people to seek more knowledge by introspection, by outside sources, right? And then knowledge gives us power, right? And if it's knowledge about truth, right, it gives us the power to do good, right? And good helps us to heal. Right. And then when we're healing, or we see the prospect of healing, that makes us hopeful. And I think that's what creates the urgency, right? I mean, you're describing a reflective process where you become aware of a trauma in you, right? And then you feel like, I want to do something about that. Right. And that hopefulness, right, then gives you a sense of urgency. Like, I want to do something about this now. Right. And like that's the idea that if we're empowered, right, with knowledge, and again, this is not esoteric academic knowledge, right? I mean, it's like the knowledge in the book is knowledge that I think all of us can understand and take in, because we can look at it and we can see the common sense of it. We can see the truth of it, right? And then that starts that cascade. We're empowered to do good things, which helps us heal, right? Which gives us hope. And then we feel a sense of urgency, right? I mean, if we see where the world is going, I mean, I think in many ways it's wonderful that people complimented, that you and the other doctor were civil to one another. But it's also so sad, right? That like, that's such an outlier to be like, wow, let's give me a pat on the, right. And I think, is that really what we're choosing? Where two people who disagree and are civil to one another is like some amazing thing? Is that the path we're choosing as a society, right? Or are we choosing a different path that's grounded to really these common sense principles? And I also write about it. They come from our religious traditions. They come from lessons of history. They come from the basics of science and medicine. They come from kindergarten education, right? Like, are we going to choose these things, or are we going to choose something that is that really is based in self-deceit and the gratification of the moment, right? Which doesn't get us anywhere good. We have a choice to make.
You remember in grade school, the golden rule. How can we forget the golden rule? I mean, that's an important tenet. You can, that's the empathy that is the prefrontal cortex, that we segregate ourselves from. It happens to us via trauma, but we impart that on ourselves when we live a pro-inflammatory life as well.
Yes.
And, we can be intellectual and try to understand why people imparted trauma onto us or caused us to experience traumatic events based upon what, for example, my mother went through in her childhood. I understand that. I understand then there's why things happened the way they did.
Mm-hmm. Mm-hmm.
But, there's still that emotional part that, if you can just experience it. Wayne Dyer once said that when you're feeling anger or other emotion, stop and just feel it, experience it.
Right.
And I get that. I mean, we want to respond to those feelings immediately.
Right.
And Deepak Chopra once said that, look, if you smoke cigarettes, I'm not going to tell you not to smoke cigarettes, but the next time you smoke, stop what you're doing, go outside, sit down, and connect with that cigarette so you are present. Right. I think to try to be present with your emotions is a very powerful tool, because the dissociation from the presence is what leads to problems. I wrote about this in a book that, somebody accosted my wife verbally at a Costco in the lineup, and I just about went ballistic, but then I stopped and tried to feel this emotion welling up within me, and I was able to bring the adult back into the room, fortunately, with cameras everywhere, right? And that ability, I think, is something people are losing, the ability to rein themselves in. And, look at the consequences. Look at the consequences in this country even, of just unrestrained reactionary behavior. And, it may well begin with their traumas. And, I think what your book makes very clear is we got to do our darndest to revisit those events and then deal with them, recontextualize them, because they're working day and night to be disruptive in our lives. And as you well characterized at the very beginning of your book, how incredibly pervasive they are in terms of serving to underlie a host of other, not just psychiatric issues, but physical issues as well. So really, really good job. And
thank you. Thanks so much.
I always tell people I'm so grateful that they wrote their books, because we generally interview people who write books that are very helpful, and especially yours.
Thank you.
And I can tell you that from my heart.
Thank you.
I'm very grateful that I read that. So thank you.
You're very welcome. I appreciate you saying that. I mean, that's the intention of it, just get us thinking about ourselves and the world around us, and entertaining new ways of being, including new ways of being with ourselves in the moment. Right. I mean, there's a way this can start inside all of us immediately. And I think that's why it's not esoteric, right? It's grounded to ways that we can change, even just stop and think about the emotion in us. Where's it coming from? Right. And I mean, there's so much benefit to be had from that. So many times negative emotion is coming from some place of helplessness or shame inside of us. Right. The shame coming from trauma. And then we want to hold someone responsible. And sometimes it is aggression outward, but sometimes the person we're angry at and hold responsible is ourselves. And there's the negative self-talk. Right. And there's the way that we beat up on ourselves, and we inadvertently then just perpetuate our own trauma. And we don't have to do that. And we can change that. And we can change that right now.
I'm so grateful for your contribution, and I know it's going to be helpful for a lot of people. I'm grateful for the time that we had today to spend together. So thanks for being here.
You're very welcome. Thank you. It was a thoughtful interview, and I so appreciate it, and thank you for having me on.
Trauma in our lives is basically a fact of life and needs to be addressed. We need to contextualize trauma in terms of what it has the potential to do to us. And I think Dr. Conti has made that very clear and has empowered us today on the Empowering Neurologist by giving us some really meaningful tools. The book is really quite interesting. I hope you'll take a look at it. Trauma, the Invisible Epidemic. Again, it's Dr. Paul Conti. I'm Dr. David Perlmutter. Thank you for joining us today. I'll be back soon. Bye for now.